100 years ago, when many families sat down to dinner, they might have eaten boiled potatoes or corn, leafy vegetables such as cabbage or collards, fresh baked bread, and, if they were fortunate, a small amount of beef or chicken. Our diet has changed drastically as processed foods, which didn't even exist a century ago, and animal-based foods now account for a large percentage of our calories. All of these choices impact our health, with short and long-term consequences as we age. It's best to start making healthy choices from a young age and maintain them as you mature. Even if past nutritional and lifestyle choices weren't aligned with dietary guidelines, older adults can still do a great deal to reduce their risk of disability and chronic disease. Improving your diet while increasing physical activity helps to control weight, reduce fat mass, and maintain muscle and bone mass. There are a number of changes middle-aged adults can implement, even after years of unhealthy choices. In this chapter, we'll focus on diet, nutrition, and the human life cycle from the remainder of childhood into the elderly years. The amounts of needed nutrients change as we pass from one stage of the human life cycle to the next. Young children require a higher caloric intake relative to body size. On the other hand, inactive senior citizens need fewer calories than other adults. Psychological, emotional, and social issues over the span of a human life can also influence diet and nutrition. Changes during childhood. Early childhood encompasses infancy and the toddler years, from birth through age 3. The remaining part of childhood is the period from ages 4 through 8. A number of critical physiological and emotional changes take place during this life stage. Children's attitudes and opinions about food deepen. This time in a child's life provides an opportunity for parents and other caregivers to reinforce good eating habits and to introduce new foods into the diet. The onset of puberty is the beginning of adolescence, ages 11 to 14 for girls and between 12 to 15 for boys, and is the bridge between the childhood years and young adulthood. Some of the important physiological changes that take place during this stage include the development of primary and secondary sex characteristics. Other physical changes include rapid growth and alterations in body proportions. Changes in late adolescence. Late adolescence is the period from ages 14 to 18. Girls stop growing taller around age 16, while boys continue to grow taller until ages 18 to 20. This life stage includes the desire for independence as adolescents develop individual identities. As teenagers make more and more of their dietary decisions, parents or other caregivers and authority figures should guide them toward appropriate, nutritious choices. Changes in adulthood. Young adulthood is the period from ages 19 to 30. Physical growth has been completed and all of the organs and body systems are fully developed. A young adult who is active has reached his or her physical peak and is in prime health. Proper nutrition and adequate physical activity at this stage not only promote wellness in the present, but also provide a solid foundation for the future. Changes in middle age. Middle age is defined as the period from age 31 to 50. The early period of this stage is very different from the end. A number of physical changes take place in the middle-aged years, including the loss of bone mass in women. Visual acuity declines in both men and women. A middle-aged person can remain vital, healthy, and near his or her physical peak with proper diet and adequate exercise. Changes in the older adult years. The senior or elderly years are the period from age 51 until the end of life. Many elderly adults face serious health challenges, such as cancer, heart disease, diabetes, or dementia. Fat deposits build up in the abdominal area, which increases the risk for type 2 diabetes and cardiovascular disease. Around age 70, men will begin to experience bone loss. Healthy nutritional choices can help to prevent or manage disability and chronic conditions. Dementia is the umbrella term for changes in the normal activity of the brain, which may include memory loss, agitation, and delusions. 1 in 8 people over the age of 64 and almost half of all people over the age of 85 suffer from the brain disorder Alzheimer's disease. Neurological disorders and psychological conditions, such as depression, can influence attitudes towards food. Elderly adults may also need guidance from dietitians and healthcare professionals to make the best dietary choices for this stage of life. Nutritional needs continue to change at each stage of life. It's important to adjust your diet and physical activity to meet these changing needs and to ensure health and wellness throughout your life. Parents must continue to help their school-aged children and adolescents establish healthy eating habits and attitudes towards food. As children become adults, they must be mindful of the choices they make and how those choices affect their health. Childhood and nutrition. From ages 4 to 8, school-aged children grow consistently, but at a slower rate than infants and toddlers. Other changes that affect nutrition include the influence of peers on dietary choices and the kinds of foods offered by schools and after-school programs. Food-related problems for young children can include tooth decay, food sensitivities, and malnourishment. Excessive weight gain early in life can lead to obesity into adolescence and adulthood. Childhood, ages 4 to 8, growing pains. School-aged children experience steady, consistent growth, with an average growth rate of 2 to 3 inches in height and 4.5 to 6.5 pounds in weight per year. The rate of growth for the extremities is faster than for the trunk, which results in more adult-like proportions. Long bone growth stretches muscles and ligaments, which results in many children experiencing growing pains. Girls between the ages of 4 to 8 require 1,200 to 1,800 calories a day, while boys need 1,200 to 2,000 calories a day. Children should be provided nutrient-dense food at meal and snack time. The bulk of the diet for children should be carbohydrates high in fiber. Children have a high need for protein as well to support muscle growth and development. High levels of essential fatty acids are needed to support growth. Micronutrient needs should be met with foods first. Because children grow rapidly, they require foods that are high in iron, calcium, and vitamin D. The next two slides highlight micronutrient levels during childhood. Factors influencing intake during childhood. Family environment, societal trends, taste preferences, and messages in the media all impact the emotions that children develop in relation to their diet. Television commercials can entice children to consume sugary products, fatty fast foods, excess calories, refined ingredients, and sodium. Parents should include children in food planning and preparation. Studies show that children who eat family meals on a frequent basis consume more nutritious foods. Malnutrition is a problem many children face. The U.S. Census Bureau characterizes households into the following groups: food secure, food insecure without hunger, food insecure with moderate hunger, and food insecure with severe hunger. Millions of children grow up in food insecure households. In the U.S., about 20% of households with children are food insecure to some degree. Growing up in a food insecure household can lead to a number of problems. The National School Lunch Program, the School Breakfast Program, and summer feeding programs work to address the risk of hunger and malnutrition in school-aged children. Parents with vegetarian children must take care to ensure vegetarian children get healthy, nutritious foods that provide all the necessary nutrients. There are several types of vegetarians, each with certain restrictions in terms of diet. Ovo-vegetarians, lacto-ovo-vegetarians, lacto-vegetarians, and vegans. Vegans technically aren't vegetarians, as they don't eat any animal products whatsoever. Children who consume some animal products, such as eggs, cheese, or other forms of dairy, can meet their nutritional needs. For a child following a strict vegan diet, planning is needed to ensure adequate intake of protein, iron, calcium, vitamin B12, and vitamin D. Food allergies and food intolerance. Recent studies show that 3 million children under the age of 18 are allergic to at least one type of food. Some of the most common allergenic foods include peanuts, milk, eggs, soy, wheat, and shellfish. Possible symptoms include itchy skin, hives, abdominal pain, vomiting, diarrhea, and nausea. Children can outgrow a food allergy, especially allergies to wheat, milk, eggs, or soy. Anaphylaxis is a life-threatening reaction that results in difficulty breathing, swelling in the mouth and throat, decreased blood pressure, shock, or even death. A dose of the drug epinephrine is often administered via a pen to treat a person who goes into anaphylactic shock. Some children experience a food intolerance, which doesn't involve an immune response. Lactose intolerance is an example. An intolerance is best managed by making dietary changes and avoiding any foods that trigger the reaction. Lead toxicity. Contaminated food and water can increase exposure and result in hazardous lead levels in the blood. Lead is indestructible, and once it has been ingested, it's difficult for the human body to alter or to remove it. Lead toxicity can damage the brain and central nervous system, resulting in impaired thinking, reasoning, and perception. Treatment of lead poisoning includes chelation therapy and EDTA therapy. The onset of puberty brings a number of changes, including the development of primary and secondary sex characteristics, growth spurts, an increase in body fat, and an increase in bone and muscle development. All of these changes must be supported with adequate intake and healthy food choices. The onset of puberty is between the ages of 9 to 13. This period of physical development is divided into two phases. The first phase, height increases from 20 to 25%. In the second phase, weight gain related to the development of bone, muscle, and fat tissue occurs. The sex hormones trigger the development of reproductive organs and secondary sexual characteristics, such as pubic hair. Energy requirements for puberty. For ages 9 to 13, girls should consume about 1,400 to 2,200 calories per day, and boys should consume 1,600 to 2,600 calories per day. Physically active preteens need to eat a greater number of calories to account for increased energy expenditures. Carbohydrates should be 45 to 65% of the total daily calories. Proteins should be 10 to 20% of the total daily calories, and fats should be 25 to 30% of the total daily calories. Key vitamins needed during puberty include vitamins D, K, and B12. Adequate calcium intake is essential for building bone. Young females need more iron at the onset of menstruation. Almost all of these needs should be met with dietary choices, not supplements. Iron might be the exception. The next two slides highlight micronutrient levels during puberty. Childhood obesity. While it's important not to impose very restrictive diets, exceeding caloric requirements on a regular basis can lead to childhood obesity. Nearly 1 of 3 U.S. children and adolescents are overweight or obese. Frequent television, computer, and video game usage leads to a sedentary lifestyle, which, along with poor diet, contributes to childhood obesity. Some of the reasons behind childhood obesity include larger portion sizes, limited access to nutrient-rich foods, increased access to fast foods and vending machines, declining physical education programs in schools, and media messages encouraging the consumption of unhealthy foods. Obesity has a profound effect on self-esteem, energy, and activity level. It's also a major risk factor for a number of diseases later in life, including cardiovascular disease, type 2 diabetes, stroke, high blood pressure, and certain cancers. A percentile for body mass index specific to age and sex is used to determine if a child is overweight or obese. If a child gains weight inappropriate to growth, parents and caregivers should limit energy-dense, nutrient-poor snack foods. It's extremely beneficial to increase a child's physical activity and limit sedentary activities, such as watching television, cell phone use, playing video games, or surfing the internet. Programs to address childhood obesity can include behavior modification, exercise counseling, psychological support or therapy, family counseling, and family meal planning advice. The goal is usually not weight loss, but rather allowing height to catch up with weight. Added sugar in store-bought items may be listed as white sugar, brown sugar, high fructose corn syrup, honey, malt syrup, maple syrup, molasses, anhydrous dextrose, crystal dextrose, and concentrated fruit juice. Sugars are often hidden in items added to foods after they're prepared, such as ketchup, salad dressing, and other condiments. Young children and adolescents consume an average of 322 calories per day from added sugars. The primary offenders are processed and packaged foods, along with soda and other beverages. One way that teenagers assert their independence is by choosing what to eat. Older adolescents can also be curious and open to new ideas, which includes trying new kinds of food and experimenting with their diet. Too many poor choices can make young people nutritionally vulnerable. It can be helpful to explain to young people how healthy eating habits can support activities they enjoy. Growth and development during adolescence differs in males than in females. In teenage girls, fat assumes a larger percentage of body weight. In teenage boys, muscle and bone growth increases. Primary and secondary sex characteristics have fully developed and the rate of growth slows with the end of puberty. Nutrient needs are greater in adolescence than at any other time in the life cycle except during pregnancy. The energy requirements are 1,800 to 2,400 calories for girls and 2,000 to 3,200 calories for boys. Teens who participate in sports must make sure to meet their increased energy needs. The recommendation for carbohydrates is 45 to 65% of total daily calories and should include whole grains such as wheat, oats, barley, and brown rice. The recommendation for protein is 10 to 30% of daily calories and should come primarily from lean proteins, such as meat, poultry, fish, beans, nuts, and seeds. The recommendation for fat is 25 to 35% of daily calories. The recommendation for fiber is 25 to 34 grams per day. Micronutrient recommendations for adolescents are mostly the same as for adults. The most important micronutrients for adolescents are calcium, vitamin D, vitamin A, and iron. Adolescent girls also need to ensure sufficient iron intake as they start to menstruate. Increased amounts of vitamin C from orange juice and other sources can aid in iron absorption. The next two slides highlight micronutrient levels during older adolescence. Eating disorders in adolescence. One study estimates that eating disorders impact 24 million people in the U.S. and 70 million people worldwide. They're more prevalent among adolescent girls, but they've been increasing among adolescent boys in recent years. Eating disorders often lead to malnourishment. Eating disorders involve extreme behaviors related to food and exercise, and they encompass a group of conditions marked by undereating or overeating. Anorexia nervosa is characterized by undereating and excessive weight loss. Anorexics have a poor body image, which leads to anxiety, avoidance of food, a rigid exercise regimen, fasting, and a denial of hunger. The condition predominantly affects females. Sufferers of binge eating disorder experience regular episodes of eating an extremely large amount of food in a short period of time. This behavior often causes feelings of shame and embarrassment and leads to obesity, high blood pressure, high cholesterol levels, type 2 diabetes, and other health problems. Both males and females suffer from binge eating disorder. Bulimia nervosa is characterized by alternating cycles of overeating and undereating. Sufferers partake in binge eating, followed by compensatory behavior such as self-induced vomiting, laxative use, and compulsive exercise. Most people with this condition are female. Eating disorders stem from stress, low self-esteem, and other psychological and emotional issues. Eating disorders can lead to serious complications or even be fatal if left untreated. Treatment includes cognitive, behavioral, and nutritional therapy. Good nutrition can help young adults enjoy an active lifestyle. The body of an adult doesn't need to devote its energy and resources to support the rapid growth and development. Eating habits and preferences developed during childhood and adolescence will influence those of adulthood. Adults must monitor their dietary decisions and make sure their caloric intake provides the energy that they require without going into excess. Young adulthood, ages 19 to 30. Growth is completed at this stage and people reach their physical peak. The human body reaches maximum cardiac output between the ages of 20 and 30. Bone and muscle mass are at optimal levels. Healthy eating habits promote metabolic functioning, assist repair and regeneration, and prevent the development of chronic conditions. Energy requirements for women are 1,800 to 2,400 calories and 2,400 to 3,000 calories for men, depending on their activity level. This does not include women who are pregnant or breastfeeding, who require a higher energy intake. The recommendation is 45 to 65% of total daily calories for carbohydrates and should limit energy-dense carbohydrates, especially refined, sugar-dense sources. Protein should make up 10 to 35% of total daily calories and should include a variety of lean meat and poultry, eggs, beans, peas, nuts, and seeds. Fat should make up 20 to 35% of their daily calories and keep saturated fats to less than 10% of total calories, and also avoid trans fats by replacing them with mono and polyunsaturated fats. Trans fats are man-made fats typically that are found in most of your processed foods and fried foods. The recommendation for fiber is 22 to 28 grams per day for women and 28 to 34 grams per day for men. Soluble fiber may help improve cholesterol and blood sugar levels, while insoluble fiber can help prevent constipation. Micronutrient needs in adults differ slightly according to sex. Males require more of the vitamins C, K, thiamine, riboflavin, and niacin, while females require extra iron due to menstruation. Both men and women who are very athletic and perspire a great deal also require extra sodium, potassium, and magnesium. It can be beneficial for some young adults to follow a daily multivitamin regimen. However, the quality of the multivitamin matters. One study showed that when an independent company tested over-the-counter supplements sold at most grocery store chains and health food stores, half of the bottles they tested didn't have a single ingredient in the bottle that the label claimed to have, and almost all of them were filled with chemical fillers. The next two slides highlight micronutrient levels during adulthood. Some nutritional concerns in young adulthood is adequate intake of fluid. The recommendation for men is 3.7 liters per day from both food and liquids. For women, it's 2.7 liters per day from both foods and liquids. It's best when fluid intake is from water instead of sugary beverages such as soda. Fresh fruits and vegetables, including watermelon and cucumbers, are excellent food sources of fluid. Young adults should limit sodium to less than 2,300 milligrams a day to avoid the health consequences of high sodium intake, including high blood pressure and its complications. Another concern is gastrointestinal integrity. Dietary fiber helps bind indigestible food together and normalizes bowel movements. It can also soften stool for those who suffer from constipation. If you aren't having a bowel movement every day, you are constipated. Constipation is a problem because if you aren't eliminating every day, you are reabsorbing the toxins that the body is trying to get rid of. All plant foods contain fiber. Animal foods do not. Excellent sources of fiber include oats, barley, rye, wheat, brown rice, celery, carrots, nuts, seeds, dried beans, oranges, and apples. Notice, though, that most wheat products that people are consuming today are refined processed wheat products. Those have been stripped of fiber. so wheat should be consumed in its whole form, as in whole wheat. Healthy intestinal microflora, we call this sometimes the good bacteria, can be supported by prebiotics. These are found in fruits and vegetables. Your good bacteria can also be supported by probiotics, which is found in yogurt and some fermented foods. Obesity during adulthood. Obesity remains a major concern into young adulthood. For adults, a BMI above 25 is considered overweight, and a BMI of 30 or higher is obese. About 2/3 of all adults in the U.S. are overweight or obese. Physical inactivity and poor dietary choices are major contributors to obesity in adulthood. Solid fats, alcohol, and added sugars make up 35% of the total calories for most people and contribute to weight gain. Middle age and nutrition. During middle age, adults begin to experience the first outward signs of aging. Wrinkles begin to appear, joints ache after a highly active day, and body fat accumulates for many. There is a loss of muscle tone and elasticity in connective tissues. Good nutrition can help middle-aged adults maintain their health and recover from any medical problems or issues they may experience. Middle age is 31 to 50. During the middle-aged years and beyond, it's important to maintain a healthy body weight, consume nutrient-dense foods, drink alcohol moderately or not at all, be a non-smoker, and engage in moderate physical activity at least 150 minutes per week. Energy requirements range from 1,800 to 2,200 calories for women and 2,200 to 300 calories for men, depending on their activity level. In many parts of North America, typical dietary patterns don't match the recommended guidelines. For example, 5 foods, iceberg lettuce, frozen potatoes, fresh potatoes, potato chips, and canned tomatoes account for over half of all vegetable intake. Following the dietary guidelines in the middle-aged years provides adequate but not excessive energy, macronutrients, vitamins, and minerals. Recommendations for macronutrients and micronutrients during the middle-aged years. The recommendations for the macronutrients, carbohydrates, protein, fat, fiber, and fluids remain the same from young adulthood into middle age. Avoid putting on excess pounds and limiting an intake of solid fats, added sugars, and alcohol to help avoid cardiovascular disease, diabetes, and other chronic conditions. Key micronutrients needed during the middle-aged years include folate and vitamins B6 and B12. It's important to meet nutrient needs with food first, then with supplementation. Preventive and defensive nutrition during the middle-aged years. Preventive nutrition is the use of dietary practices to reduce disease and promote health and well-being. Eating unrefined carbs instead of refined carbs and avoiding trans fats and saturated fats help to promote wellness. Phytochemicals are compounds that are found in fruits and vegetables, and they act as defense systems for plants. They can also serve protective functions in humans. Foods high in antioxidants, such as strawberries, blueberries, and other colorful fruits and vegetables, reduce the risk of cancer. Carotenoids are found in orange-colored fruits and vegetables. These include carrots, cantaloupes, sweet potatoes, and butternut squash. They may protect against cardiovascular disease. A phytochemical found in watermelons and tomatoes called lycopene may protect against stomach, lung, and prostate cancer. Omega-3 fatty acids found in oily fish, including salmon, mackerel, tuna, herring, cod, and halibut, can help to prevent coronary artery disease. Monounsaturated fats, which are found in plant oils, avocados, peanuts, and pecans, are vital for healthy functioning of the body. Menopause typically begins in the late 40s or the early 50s as the ovaries slowly cease to produce estrogen and progesterone. Menopausal symptoms can vary, but often include hot flashes, night sweats, mood changes, and alterations in body composition, such as weight gain in the abdominal area. Bone loss is another common condition related to menopause, increasing the risk of fractures, which can affect mobility. The recommendations for women experiencing menopause or perimenopause include consuming a variety of whole grains and other nutrient-dense foods, maintaining a diet high in fiber, low in fat, and low in sodium, avoiding caffeine, spicy foods, and alcohol, eating foods rich in calcium, and doing stretching exercises. Old age and nutrition. After the age of 60, blood pressure rises and the immune system may have more difficulty battling invaders and infections. The skin becomes more wrinkled and hair has turned gray or white or even fallen out. Short-term memory might not be as keen as it once was. Many people suffer from serious health conditions such as cardiovascular disease and cancer. Good nutrition is often the key to maintaining health later in life. During old age, we see a decline in hormone production, muscle mass, and strength. The heart has to work harder because each pump is not as efficient as it used to be. Kidneys are not as effective in excreting metabolic products. Older adults should continue to consume nutrient-dense foods and remain physically active. The loss of mobility among frail, homebound elderly adults also impacts their access to healthy, diverse foods. Energy requirements for people ages 51 and over are 1,600 to 2,200 calories per day for women and 2,000 to 2,800 calories per day for men, depending on activity level. The recommendations for the macronutrients, carbohydrates, protein, and fat remain the same from middle age into old age. Fiber is especially important in preventing constipation and diverticulitis, and may reduce the risk of colon cancer. An increase in certain micronutrients can help maintain health during this life stage. Calcium recommendation increases to 1,200 milligrams per day for both men and women. Vitamin D recommendations also increase to 10 to 15 micrograms per day for men and women. Vitamin B6 recommendations increase to 1.7 milligrams per day for older men and 1.5 milligrams per day for older women. Older adults require an intake of 2.4 micrograms per day of B12. For elderly women, higher iron levels are no longer needed post-menopause. People over the age of 50 should eat foods rich with all of these micronutrients. Nutritional concerns for older adults. Dietary choices can help improve health during this life stage and address some of the nutritional concerns that many older adults face. There are specific concerns related to nutrition that affect adults in their later years, including medical problems such as disability and disease. Dental problems can lead to difficulties with chewing and swallowing. There's also a decreased thirst response in the elderly, and the kidneys have a decreased ability to concentrate urine. Older adults also start to experience sensory issues. At about the age of 60, taste buds begin to decrease in size and number. Taste threshold is higher in older adults, meaning that more of the same flavor must be present to detect the taste. This can make food seem less appealing and decrease their appetite. The sense of smell also decreases, which impacts attitudes toward food. Sensory issues may also affect digestion. Another concern is gastrointestinal problems. Saliva production decreases with age, which affects chewing, swallowing, and taste. Digestive secretions decline later in life as well, which can lead to atrophic gastritis. Reduction of the digestive enzyme lactase results in a decreased tolerance for dairy products. Slower GI motility can result in more constipation, gas, and bloating. Dysphagia is a disorder which impairs the ability to swallow. Any damage to the parts of the brain that control swallowing can result in dysphagia. Therefore, stroke is a common cause. It's also associated with advanced dementia. To assist older adults suffering from dysphagia, it can be helpful to alter food consistency. Speech therapists, physicians, and dietitians work together to determine the appropriate diet for dysphagia patients. Adults over the age of 60 are more likely to be obese than young or middle-aged adults. Being overweight or obese increases the risk for potentially fatal conditions that can afflict the elderly, including cardiovascular disease and type 2 diabetes. Obesity is also a contributing factor to arthritis. Dietary changes to promote weight loss should be combined with an exercise program to protect muscle mass. It's best to be cautious and consult with a healthcare professional before beginning a weight loss program. The anorexia of aging is characterized by poor food intake, which results in dangerous weight loss. This leads to a higher risk for immune deficiency, frequent falls, muscle loss, and cognitive deficits. It's important for healthcare providers to examine the causes for anorexia of aging among their patients. Nutritional interventions should focus primarily on a healthy diet. Healthcare professionals should consider a patient's habits and preferences when developing a nutritional treatment plan. Vision problems. Age-related macular degeneration is the leading cause of blindness in Americans over the age of 60. This disorder can make food planning and preparation extremely difficult. Self-feeding may also be difficult if an elderly person cannot see his or her food clearly. Consuming colorful fruits and vegetables increases the intake of certain antioxidants that will provide protection for the eyes. These are found in green leafy vegetables such as spinach, kale, and collard greens, and also corn, peaches, squash, broccoli, Brussels sprouts, orange juice, and honeydew melon. Neurological conditions. Elderly adults who suffer from dementia, including Alzheimer's form, may experience memory loss, agitation, and delusions. These conditions have serious effects on diet and nutrition as a person increasingly becomes incapable of caring for himself or herself, which includes the ability to buy and prepare food and to self-feed. Good nutrition and regular physical activity can help you live longer and healthier. Poor nutrition and a lack of exercise can shorten your life and lead to medical problems. Nutritious foods form the foundation of a healthy life at every age.